Hi, I'm Dr. Jump, and I practice at the Bel Air and Glen Burnie offices for Center for Vein Restoration. When you come into our office, we want you to feel comfortable. We're a happy bunch, from our front desk staff straight through to the vascular techs and the nurses and myself, and we want you to feel like family when you're with us. We want you to come in and leave having a complete understanding of what venous insufficiency is, but more importantly, how it pertains to you and your problems. We're going to do an ultrasound study that will determine to what extent you may have some problems with your veins. And if so, we're going to use that study to generate a very personalized treatment plan geared towards treating your symptoms. I take a very personal approach towards treating my patients, and we want all your questions to be answered. When you leave, we want you to feel comfortable in knowing that our main goal here in this office is to get you feeling better, get your legs feeling better, and back to the activities that you love to enjoy. Well, the most common symptoms people will experience if they have vein disease are achiness in the legs, heaviness or fatigue in the legs, especially as the day goes on. A lot of times they'll have cramping at night. A lot of times that'll wake them up from sleep. And as vein disease gets more advanced, they'll start developing maybe some bulging varicose veins in the legs or some clusters of spider veins. It can develop into a lot of swelling in the legs and even sometimes darkening of the skin, particularly in the calves. So if you have those symptoms, an ultrasound test is the definitive way to determine if someone actually really does have vein disease. It's a painless study that gets a look at the veins below the surface of the skin. And if there are some problems that we see below the surface of the skin and the veins, then there's treatments that can be performed to help your legs start feeling better again. Well, the answer is no. So while compression stockings play a very important role in treating the symptoms or helping to control some of the symptoms of vein disease, it's not the definitive treatment. The treatment, there are treatments. They're non-invasive treatments that are done in an office setting relatively quickly with no downtime associated with the treatments that can fix the problems in the veins that are causing the symptoms. In order to know if someone has vein disease, there's an ultrasound study that's painless that can be done in the office as well, relatively quickly also. And that'll take a look at the veins below the surface of the skin. Based on the findings from that ultrasound, a personalized treatment plan can be generated geared towards focusing right on those veins that are causing the problems. And that's how you end up with the cure for vein disease.